Dr. Deeb is a movement disorder specialist. He currently moved to the University of Mass, and he's assistant professor of neurology there. And he's co-author of the book, Living with Parkinson's Disease.
No, thank you for having me. And as you mentioned, I was at University of Florida up till June, and then I moved to University of Massachusetts from July. So that's why I'm on this first slide. It's all three places, UMass Medical School, the UMass Hospital, and then the University of Florida. So the book, effectively, I wrote it with Dr. Oken and Dr. Malati, who I was with at University of Florida. And the reason we wanted to do the book is because, as you know, Parkinson's, you always see this iceberg picture. You might have seen it multiple times, is that Parkinson's disease, what you usually discuss with your doctor is usually the tip of the iceberg. You have the tremors, the stiffness, the walking problems, but beneath the surface, there's so many other things that can change. You can have sleep problems, you can have skin problems, you can have memory problems, you can have stomach problems, intestine problems, mood problems, sometimes hallucinations. So there's a lot of what we call non-motor symptoms. So the real impetus behind the book is to give people with Parkinson's a guide for all these symptoms of Parkinson's that is not just a summary of data. It's not like a list of what is known and what's not known, but also some practical tips that you can use. So the way the book is made is that you have like quick to find, easy to find, let's say recipes or tips that you can use for certain situations. And given that today we're speaking about nutrition, I just took two things from the nutrition chapter that gives you an idea about how the chapter is organized. So there is, for example, one constipation strategy. We call it the constipation formula. This one gives you an idea about certain things you can find in your cupboard or easy to find in the store that you can mix, prepare once a week, and then use every morning to help to regulate your bowels. Another one is something we call the bowel cleanout. This is like the emergency situation when, let's say, you haven't gone to the bathroom, haven't had any bowel movement for a few days, and then you're feeling really bad. This is what you need to take to help you get out. All of these are over-the-counter substances, but that way you can quickly find those resources to help manage your symptoms. So this is the idea behind the book. And then the major thing, as I said, is to focus on these less focused on symptoms, like, for example, nutrition, which we're going to speak about today. So in terms of nutrition, it is a very important thing to speak about in Parkinson's disease, but it is usually not very much discussed, whether it is with your doctor or between people with Parkinson's disease. It is very common. The risk of malnutrition in Parkinson's disease is up to 60%. So that's quite high. Almost like 2/3 are at risk of malnutrition. And then weight loss occurs in almost 1 out of every 4 people. So that's also a very high number. And malnutrition doesn't mean that it doesn't always equate to weight loss. So in many cases it does, but malnutrition can be something called like protein malnutrition, where the person restricts how much protein they're eating, or they're not eating enough protein and they lose lean muscle mass. And then their whole body weight will stay the same, but they'll become weaker and have more complications. And there are many, many factors why people with Parkinson's develop this malnutrition or weight loss. And we don't know all of them, and we don't know their interplay. We know, for example, that where they are in their stage of the disease has a factor. So there is the most common feature or most common change you would see is that just before being diagnosed with the motor symptoms, so before the stiffness and the slowness happens, most people with Parkinson develop a slight weight loss. But that doesn't mean everybody, but many people develop a slight weight loss. And then after they start treatment early in the disease, most people develop some weight gain. And then as the disease reaches more advanced stages, most people then develop significant weight loss. Usually they come together. There is significant weight loss and significant progression at the more advanced stages of the disease. And we still don't understand why that happens. Also, like using deep brain stimulation can also alter that trajectory a little bit. So there's a lot of stuff we don't understand about why the stage of the disease influences weight. It could be related to chemical changes in the brain and appetite changes. But there are other factors that you've all known or heard about. Swallowing problems, that's a very common thing that can happen in Parkinson, usually more advanced, but can happen early on. So people might become more scared to eat, or they would decrease how much they're eating, or even using thickening agents to eat. And these usually make food not taste that great. So that could be a factor. Another thing is loss of sense of smell, which is very, very common in Parkinson. So food becomes a little bit bland, metallic, change in flavor, and that also can affect appetite. Poor dentition, that can happen because of poor mouth hygiene, that can happen in Parkinson's because of dryness in the mouth. So that can become more higher than other people with the same age. Also, you've all heard of something called sluggish stomach or gastroparesis, which is the stomach becomes slow. So when you eat, it takes longer for the food to go to the intestine. So effectively, you can eat only a smaller amount because you feel heavy the food feels heavy, and then you feel full very quickly. And in that case, many people say that they feel like they're eating stones. It's so heavy. So they end up not finishing their plate. And then that can make them also lose weight. Another thing that can happen is the symptoms themselves. So imagine a person has frequent tremors, or they have a lot of stiffness in their muscles, or they have dyskinesia, which is this dance-like wiggling type of movements. So this is effectively exercise all day long. Your muscle is working. Every time your muscle is contracting, it's really using energy. So effectively, you're exercising almost 24 hours. And then you effectively would need more calories, more food to compensate. And with all these other factors, it might not be enough, and you might start losing weight. Another thing also is the medications we give you. So they help your motor symptoms, but as you know, the most common medication we use, which is also the most effective, is carbidopa-levodopa. And if you've taken this medicine, the first thing your doctor would tell you is watch for nausea, because it's the most common side effect. It happens in 1 out of 4 people with carbidopa-levodopa. It's quite common. And that's not saying that you shouldn't take the medicine, but it is a common side effect. And then if that's not controlled or not discussed, a person might simply not eat as much, or might not be capable of holding down the food, and that can make them lose weight too. Another thing that people would do is, as you've heard also with this medicine, is that some people are very sensitive to how much protein they're eating with this medicine. So for some people, not everybody, most people usually don't have any issue with the protein. But some people, when they have a large meal that has a lot of protein, so let's say they ate a double burger or something like that, that in that case, they would notice that the medicine isn't working as well. And because they need the medicine to work well, they would start either restricting how much protein they're eating, which means that they will cause themselves to have protein malnutrition, or they will redistribute protein, but not in an efficient way, and end up having protein malnutrition, which means that they would not have protein except at the end of the day. But you're not going to have enough because you're only having it at one time, and that's a little amount because you're going to get full before you can get enough protein. So in many cases, because of how the medications interact with either nausea or with the protein effect on the diet, many people restrict themselves, especially if they don't have any guidance on how to do these things to avoid that problem. So for example, let's take a person who's 70-year-old, who weighs around 70 kilos, so that's around 170 pounds almost, and then and exercise as recommended around 4 times a week. They would need around 3 to 4 servings of chicken breast every day to maintain protein at least. All right, so that is the minimum amount a person who's 70, weighing 70 kilos, and exercising at around 4 times a week. So of course, if you're exercising more, if you have more tremor, if you have more dyskinesia, you need more. But this is where it is very important to keep that in mind. Other factors that can play a role are mood symptoms, especially depression. Depression is a very high risk or risk factor for having weight loss and malnutrition. We don't understand all the mechanics there, possibly loss of appetite when a person is depressed, but could be other factors. Dementia also is associated with poor nutrition too. And this is where a caregiver can help to maintain food intake for people. So this is speaking about that is a complex problem. There could be multiple reasons why a person is having malnutrition, and it's very important to keep it in mind. Now you might ask me, why should I care? Why should I care? I'll be skinnier. Everybody wants to be skinny. Why is that not a good thing in Parkinson's disease? So we don't want you to be obese, but if you're too skinny in Parkinson's disease, then there can be negative consequences on your symptoms themselves. So you can have faster disease progression. So symptoms, your motor symptoms will progress faster than if you were not malnourished. You will have lower quality of life, decreased mobility, which means difficulty moving, and then also a higher risk of needing a hospital stay. And also when you go to the hospital, you get malnourished, and then it becomes a bad cycle. So as you know, in Parkinson, we usually want you not to go to the hospital if you can. And that's why you get all these different programs that you're doing, like physical therapy, occupational therapy, exercise, counseling, so that you can avoid that hospitalization. So being malnourished will increase all these factors and accelerate disease progression. So that's why for us, that's a big red flag, and it's very important that we address as early as possible. So how do we address that? Like anything, we start initially by asking questions, and many of these things you can do at home. So checking, like doing a food diary, checking what you're eating and how much you're eating for a week, for example, just to see if you're meeting this minimum amount of protein, this minimum amount of calories. You can also track your weight. So maybe check your weight once a month for a few months and see how your weight is changing over time, because that usually gives you a better idea than checking your weight once a year. And another factor is something called the BMI. BMI is body mass index. It simply compares your weight to your height and gives you a number. And usually a BMI that's low, less than 20 or 22, would mean that you're malnourished. That's usually the sign. But you can have a normal BMI. You can have a BMI of 25, but still be malnourished. As we spoke, you can have protein malnutrition. So it's not a target by itself. It's not the only thing you check, but that's a factor that you can check. You can check BMI changes over time. If BMI is trending down, so you started with 25 and then 24 and then 23 and now you're 22, that means that most likely you're getting malnourished over time. Another thing that's easy to measure is the arm circumference. Simply use a measuring device and measure the mid-arm size. If it is less than 9 inches in men or 8.5 inches in women, usually that's highly sensitive that you have protein malnutrition, you're losing muscle mass. So that can give you an idea too. None of those is like by itself an indicator, but if more than one are present, that can be the case. Another area of the body you can measure is the calf, the thickest part of the calf measurement. And in that case, if it is less than 12 inches, also that is a sign of malnutrition. Another thing, if you go to a dietitian, for example, they will measure your skin fold thickness. So they would grab a device that can squeeze the skin around the triceps area, so here in the back of your arm. And that also is another measure of malnutrition. And then we also can do some blood work that can help us know. So usually we do a combination of these things to help us know what's your nutritional state, and then also determine what we need to work on. Is it the total calories that we need to work on? Is it the protein that we need to work on? In many cases also, we ask you to see a dietitian if you're having weight loss, because they will have the training and the expertise to help you navigate the aspects, and give you different options to try to remedy this. Because if there is protein deficiency, then there could be certain supplements of protein that you can take. If it is calorie deficiency, they might recommend that you eat stuff that usually doctors don't usually want you to eat, like cheese and stuff like that, that have a lot of calories, and they're what we call calorie dense food material. So that's usually what we would do in the clinic visit if we're focusing on nutrition. And then depending on our concern, we would most likely recommend, if that's the case, we would recommend that you see a dietitian or a nutritionist to help you. Now,
give me a time that we can do this on
Is somebody asking a question? Suji, are you speaking? Because I think you're muted.
I think we're fine. You
You're
can
fine?
go ahead. I'm sorry.
No, okay, sorry. All right. This slide is busy because this is where most of the questions usually happen. It's like, okay, what should I do? What should I eat? How should I keep my health with Parkinson's disease? So initially we were speaking about what happens because of Parkinson's disease, that you're at risk, a person with Parkinson's disease is at risk of being malnourished. So the important thing is to track that and make sure that that's well evaluated and well managed. But then what can a person with Parkinson's disease do, even if they don't have malnutrition, to eat a healthier diet? Now, I wish I have the answer for all of you. And the reason we don't have the answer is to answer this question is very complicated. Effectively, when we're doing studies, we have to have people stick to a certain specific diet for a very long period of time and do it in 2 different groups. And that's really logistically really hard. Imagine you need to eat the same type of thing for months on end. That's really hard to do. And to stick with it very well without slipping a bit of chocolate there or a little bit of beer there or something like that. So it can be very, very tricky. But with the information we have, and most of the information we have is from epidemiological studies, so looking at populations in general and seeing how they're doing, we can discern certain things. So for example, not that I would recommend smoking, but we know that people who smoke have a lower risk of having Parkinson's disease. Now, we don't think it's nicotine because there was a study that was done that used nicotine patches, but then that didn't decrease the risk of Parkinson's disease. So there might be something else in the tobacco plant that might be protective against Parkinson's disease. So, as again, I'm not recommending smoking because the risks of that for your other general health is not as good, but it is something to investigate at least. Caffeine seemed to also help. People who drink coffee seem to have better symptoms with Parkinson's and also have a delay at least in their symptom onset. Again, this is not saying that you have to drink too much coffee. We don't know the dose, we don't know how it works, but this is some signals that we know. Drinking beer seems to protect against Parkinson's disease. Beer, not other alcohol. And we don't really understand why. So it doesn't work as well for wine, for example, or liquor. But it possibly that beer increases your uric acid levels. So if you have gout, that's not a good thing. but uric acid has been linked to decreasing risk of Parkinson's disease. So it is possible that this is why people who drink beer have a lower risk of Parkinson's disease, but we really don't understand that very well. Is it that beer is changing the bacteria in the intestines or decreasing inflammation or doing anything else? We don't understand, but it seems that when you look at the multiple studies looking at populations, people who drink beer more than other people who don't drink beer have a lower risk of Parkinson's disease. What about types of diets, high fat diet, high sugar diet or stuff like that? We know, for example, that people who are obese have a higher risk of having Parkinson's disease. Now, is that related to the different hormonal changes that happen in the body with obesity, or is it related to fat? We don't know that very well. They did some studies on rats where they fed them very high fat diets, and these rats developed more Parkinson's symptoms than other rats who did not have high fat diet, but that doesn't mean that's going to apply in humans and doesn't mean that fat is bad in humans. So, but at least there is some link between obesity and Parkinson's disease. We also don't understand the effect of high carbohydrate diets or maybe high sugar diets. If you're eating a lot of sweets, how is that going to affect Parkinson's disease or the bacteria? And also the other question is, what about the vitamins, for example, vitamin C, vitamin E, vitamin D, vitamin A? You see a lot about those, what we call micronutrients, these nutrients that you need only a very small amount of to maintain health. Again, the evidence there is very limited for all of these vitamins. Vitamin E, possibly in 2 studies was positive, but in 2 other studies was not. Vitamin C was positive in 2 studies, negative in 3. So there is what we call conflicting evidence, and the studies are small. So at this point, I would not recommend that you take them extra other than maintaining a healthy mixed diet that will usually have all these vitamins in it. Now, what about the best diet? Is the Mediterranean diet the best, or is an American diet the best, or a Chinese diet the best, or something like that? What is the best diet to eat, or a plant-based diet, or a vegan diet? Also, we don't have a direct answer. The diet that was most studied so far for Parkinson is the Mediterranean diet, which is a diet that has it's not a vegetarian diet, it's a mixed diet, but there is a higher amount of legumes and vegetables in terms of compared to other food elements. And this one, and some of the studies has been shown to possibly improve some of the symptoms in Parkinson's patients. But again, these are very small studies, and more studies are being done all the time to help answer that question. Plant-based diets, also there are very small, what we call cross-sectional studies, which means that you look at a population at one time, but you don't do any experiments, shown that people who have plant-based diets, whether vegetarian or vegan, seem to have a lower risk of Parkinson's disease, or they do better with the Parkinson's symptoms. But this is not very well established yet. So I usually don't recommend a specific diet. I usually recommend the Mediterranean diet because we know that works well for blood pressure and heart health. And I'm also from the Mediterranean, so please all go buy Mediterranean diet, have more of it in the fridge because I like it. But other than that, there is not a lot of evidence to recommend that scientifically. The major thing really is for general health. I would recommend, because we have good evidence that it decreases the risk of heart attacks or strokes or high blood pressure. So why not do that if you want to do a diet modification? And there is possibly a signal that it can help decrease Parkinson's symptoms. So also, then that will be a win-win if that's the case at the end. Another type of substance that might be associated with an increased risk of Parkinson's is milk. Not dairy products, so not cheese or yogurt, but milk, milk cream and stuff like that. And we don't really understand why. Is it related to inflammation? But possibly it's related to pesticides that not make it into the milk anyways and get concentrated there. Or it could be related to a decrease in uric acid levels, because drinking milk decreases your uric acid levels, opposite to what beer does. So it could possibly be the reason. So we really don't understand why, but that's an interesting observation observed in a couple of studies. Not all the studies have shown it, but in a couple of studies have shown that a higher use of milk is associated with a higher risk of Parkinson's disease. But again, it could be simply pesticide exposure. So this is how messy is to give you recommendations specifically, because the information we have is limited. Most of it is anecdotal or based on small studies that can have a lot of biases, a lot of other factors that we're missing, like pesticides. We usually don't check for those levels when we're doing these types of studies. Environmental exposures we know are very important for Parkinson's risk. So there are a lot of stuff that might complicate this. Another thing now that's getting a lot more interest is the microbiome or microbiota. This is the group of bacteria, fungus, all types of microorganisms that grow naturally in our intestines. We have millions upon millions of cells of bacteria and fungi that grow in our intestines normally, and without them, we will not be capable of living. Our intestines will not work, our immune system would not work. So we need those bacteria and fungi in our system. But the way they interact with our body might be a factor why some people develop Parkinson and others don't. And this is what we call the brain-gut axis. So how the brain and the gut are interacting together. And we're starting to learn more about this interaction. It's quite complex. There are multiple factors there that are both from the brain to the gut and from the gut to the brain, interacting also with the nervous system outside the brain, as well as the hormonal system outside the brain too. So there's a lot of complex interactions that happen between these two systems. And the other thing that we don't know is which starts first, the chicken and the egg problem. Is the brain problem starting first, then the intestinal problem is starting, or the other way around, the problem is starting in the intestine that goes to the brain and gives you Parkinson's symptoms. So it could be either way, or it could be both, and it could be different in different people. So at this point, we really don't understand that relationship. And then this is to show you about the interest in this condition, in this gut-brain axis problem. So if you search for Parkinson's and gut in search engines that we use for medicine, you would notice that before 2010, there hasn't been a lot of interest in this connection. Even like in the 70s, 80s, even the 90s, barely any, or maybe zero sometimes. And then since the 2010s, there has been effectively an explosion of interest. So let's say in 2019, we had maybe around 165 publications. And then the 2020 looks, it's a bit lower, but we haven't finished 2020, and it's already almost the same number as 2019. So most likely it's going to be even continuing that trend to be much higher, which is quite encouraging because we know that there is a relationship. We know that people with Parkinson's disease have a different gut bacteria than people without it. We know that there is inflammation in the gut in people with Parkinson's that's not present in people without Parkinson's. So it is going to be an important thing to study. And we know from, I'm not sure if, I think most of you have heard about that study where they got these mice that are at risk of having Parkinson's disease. And they bred them so that they have no bacteria in their intestines. They're sterile mice. So that's very unnatural, like no human exists without bacteria that exist. So these are it is a very experimental process, but these mice that are genetically predisposed to have Parkinson's did not develop it when they had sterile intestines. And when they gave them the bacteria again, then they developed it. And then when they gave them the bacteria from mice that had Parkinson's symptoms, they developed it even faster. So it is really, there is a link, but we still don't understand what it is. So I cannot tell you, okay, don't take this bacteria or take this antibiotic, but it is something that we need to learn more. And this is based on one of the hypotheses that we think about when we think about how Parkinson's disease happens. So as I said, there's no one hypothesis. We have different ways of thinking of Parkinson's, and it could be that the different people, their Parkinson's starts differently. So some people, their Parkinson might start in the brain and then spread outside the brain. But the most common hypothesis, which was proposed in 2004, you might have heard of it, called the BRAC hypothesis, B-R-A-A-K, says that the inflammation starts outside the brain. These abnormal proteins called the synuclein protein accumulation, called Lewy bodies, they start outside the brain, possibly in the intestines, and then spread through the nerves, because the nerves go through everywhere, including the gut, and then go from there to the nerves, and from the nerves back into the brain, and then spread inside the brain and give Parkinson's symptoms. So that's one of the hypotheses, called the BRAC hypothesis. And this hypothesis starts here, as you can see here in the graph, starting from left to right. There is an inflammation trigger, some form of inflammation that happened. We haven't found a bug yet that is linked to that inflammation, but that's the hypothesis, that something comes in, gives you an infection or an inflammation that triggers some chronic changes, including changes in the microbes, that then cause an inflammation in the gut and makes your gut leaky, makes it easier for stuff to come out of the gut. And these stuff are usually chemical molecules that bacteria produce naturally, and our body is exposed to them all the time, even if you don't have leaky gut. But with leaky gut, the amounts would change. There will be some things that will become more present in the blood, and others that will become less present in the blood. And the idea here is that then this inflammation spreads out, goes out from the gut, goes to the brain, and then give you neuroinflammation, inflammation in the nervous system, as well as degeneration, which then will give you the Parkinson's symptoms. So that's the hypothesis. And that's where this brain and gut axis work is based on this hypothesis, that we're trying to determine how this is going, how it's spreading, how can we stop it, as it's going through that. And as I said, that might not apply to all patients with Parkinson's disease, might apply only for 10% of them that they have this type of progression. But even if we can understand that for 10% of patients, that will be a great advancement. So this is where this work with these publications I show with the explosion of publications is trying to work on some of these aspects. It could be on the initial portion, on the leaky gut, on the spread, on the microbes. They're working on all these different aspects. So let's speak about the leaky gut. So what do we know so far about this leaky gut? So there are multiple factors, I said, that are released from your intestines, everybody, throughout the time, that help our immune system regulate itself, that help our hormonal system regulate itself, that help our nervous system to regulate itself. And some factors, so far, there's some evidence, there's not 100% evidence, but some evidence that some factors seem to protect people from Parkinson's disease. And these factors that are produced by bacteria, some of them are the short chain fatty acids. So these are small fat molecules that bacteria produce from digesting your own food that can help against inflammation and seem also to help against Parkinson's disease. Other one is hydrogen sulfide. That's the smell of rotten eggs. So that one seems to be helpful too. Another one is hydrogen gas, H2. That also, they did a small experiment in mice where they had water enriched in hydrogen gas, which you can do very easily. And these mice had less chance of having Parkinson's disease. Again, this is my study, so I wouldn't recommend that you drink that water already, but it's just that it indicates that these substances might have some benefit in decreasing risk of Parkinson's disease or changing the bacteria in a certain way, or the connection between the gut and the brain, and that signal between the two to decrease the chances of Parkinson's disease. So these are receiving a lot of attention right now to see if we can use them either to slow disease progression or even prevent it. And on the other side, there are some molecules produced by the gut and the bacteria that can induce inflammation and induce Parkinson's disease. So that's also another component of work trying to identify those. So this is still what we call very basic work. It's so far still from being used in the clinic where we give you a pill to do for that, but this is certain things that we're starting to understand in that connection with this leaky gut and these substances that are different. So people with Parkinson's disease seem to have less of those protective factors. If you take their blood samples, they have less of the short chain fatty acids, less hydrogen sulfide, less H2 compared to people who don't have Parkinson's disease. Now, again, chicken and egg problem. Which one started first? Is it the Parkinson in the brain that started and caused these changes in the bacteria and causing these changes in the levels, or the other way around? We still don't know that, but this is an interesting signal here. It's interesting information. Another thing is the change in bacteria. So we know for sure that there's difference in bacteria between people with Parkinson and people without. But what we don't know for sure is what changes. Now I'm going to give you some studies, and then you're going to see how different they are. So if we look at a Chinese population, this study is very small, just 10 patients with Parkinson's and 10 patients without. And so northeastern part of China, and then bacteria that were more in Parkinson's are the ones to the right side. These are like Rominococca, Vericomicrobia. And then the ones that were more in people without Parkinson's are the bacteroids and the Prevotella. Now, if we look at another study, this one is Taiwanese population, we see that this Bacteroides here that was more in people without Parkinson's, so you'd expect that it should help against Parkinson, was more in people with Parkinson. So it's like the opposite. The other thing that wasn't there is the Lactobacillus. I'm not sure if you've recognized this name. Lactobacillus, this is the one that you have in probiotics, or that you use to ferment cheese, to ferment yogurt, or any fermentation. Usually we use Lactobacillus. So this seems to be higher in people with Parkinson's disease. This one is a slightly bigger study. They had 80 patients and 80 controls. But again, it shows you that there's variability. If you look at this group of bacteria, Prevotella, in these two studies, both of them are higher in people without Parkinson. But if you look at the 13 studies that have looked into this problem so far, only 30% show this pattern. The others show that Prevotella is all over the place. So again, we still don't understand exactly what is changing. Now, the most recent study was published from the United States, It was published just recently in June. And it is a study of multiple places from New York, Georgia, Alabama, and Washington states. And they observed they had a much higher number of patients. They had around 500 people with Parkinson's and around 350 people without. So that's the group that they compared. And then they observed that they identified 3 groups of bacteria or microorganisms that are different between these 2 groups. We've seen some of them already. So there is these probiotic agents. So lactobacillus, bifidobacterium. So these are the stuff like whenever you go to the pharmacy, buy probiotics, this is what's inside of it. They seem to be present more in people with Parkinson's disease. Again, this doesn't say that you shouldn't take probiotics. It doesn't mean, again, this is the egg and the chicken problem. But it seems that, let's say if that is the case, it seems that these probiotic bacteria might not be as good. If that's the case, if we follow that logic, which we don't know yet, they might be worsening motor symptoms. They might have constipation, but they might be worsening stiffness. Again, we don't know this for sure, and we might discover that that's not the case, but this is something that we need to investigate more. So something might be good for something, but might be bad for another thing. This is, again, these short chain fatty acids here. And this is a signal that's very consistent with almost all the studies, is that bacteria that produce these protective factors seem to be less present in people with Parkinson's disease. And these are the 2 major groups of bacteria that produce those fatty acids. Now, that we don't know yet if we replace these bacteria, would that help people with Parkinson's disease? We don't know that yet. But that's the nice thing about these studies, that they give you certain venues for you to try certain pathways, which might work or not, but at least gives you certain hypotheses to try and try to work on. And this is a very robust signal that's been in multiple studies. The new thing that this study has shown are these ones here, the opportunistic pathogens. So this is the middle one on the left. These are bacteria present in almost all of us, but in certain situations, let's say you took a certain antibiotic or anything, they might grow up and give you disease, give you a sickness like diarrhea, stomach upset, something like that. So the interesting thing about those is that could these be this inflammation trigger? Could this be the reason for the initial infection that we see in people with Parkinson's? Because they are more in people with Parkinson than people without Parkinson. Again, this is a question. That doesn't mean yes, but it will be interesting to find that information. So, so we have more questions right now, really, than answers in this field, and knowing what the bacteria is doing. But it's very interesting and very exciting because there's a lot of information there that hopefully we would develop, we would understand, and then be capable of giving better advice about, okay, yes, let's give you more of this bacterium, Helicobacterium, for example. Give it to you with the levodopa, because then it's going to help your symptoms. Or give you an antibiotic that will destroy the Corynebacterium, because then it's going to help decrease your risk of Parkinson's. So that's possibly what might happen from this type of investigation. But at this point, we don't know the answer. I don't want you, if you're taking probiotics, not to take probiotics anymore, because they really help constipation. And we really don't know if this is related in any causative fashion. It could be simply there and not causing anything. It's just being there. The only thing we know for sure, for example, is that the probiotics can interfere with the absorption of levodopa. So it's very important to track that if you're adding probiotics to your medications, because the bacteria, the lactobacillus, can break down levodopa. So it can degrade it into dopamine. And as you know, dopamine cannot make it to the brain by itself. So it just breaks it down in the intestine and goes out. So for some people that can make an effect, but for most people it's not significant because the amount you're having is very small. That's one thing we know, that these bacteria, the probiotics, can interfere with your Parkinson's disease. Now, the other thing that this might lead to is something called fecal microbiome transplantation, which means that you take the bacteria from one person who's healthy, doesn't have Parkinson's disease, and then put it through an NG tube into the intestines of a person who has Parkinson's disease and see if that will help their symptoms. I'm not sure if you read, there are few cases of people trying it in different places around the world, but there hasn't been a study really. It's all what we call anecdotal. One person tried it. And so it will be something that might be considered in the future, but we're so far at this point because we still don't understand what is changing in the gut and what direction we should change it. But it's already a treatment that you can use in the hospital for other reasons. So for certain types of chronic gut infections from bacteria, we sometimes use this, but there's no evidence right now for Parkinson's disease at all. The other one you might have heard of is the Helicobacter pylori. That's the bacteria in your stomach and duodenum that can give you ulcers, stomach ulcers and duodenal ulcers. We know that Parkinson's disease and stomach ulcers are quite linked, and they've been linked. We know about that link since the 50s. And then in the 80s, 90s, we discovered this bacterium, and which explains almost all the cases of ulcers in the stomach. And then we know that people who have this bacterium usually have more motor signs. So they have more stiffness, more slowness than people who don't. And treating it with antibiotics, that's the treatment, it's a 3-week antibiotic treatment, usually improves the slowness, symptoms in people with Parkinson. Now, some patients, on the other hand, as you're treating them for the Helicobacter pylori, the slowness gets better, but their stiffness gets worse. And we don't understand if this is related to how the antibiotics are affecting other bacteria, changing the connections between the gut and the brain. We don't know. But that's also interesting to see, because antibiotics don't work only on one bacterium. They affect almost everything. So we don't understand that. But usually what we recommend is that if you know that you have this bacterium and you have Parkinson's disease, it's very important that you get treated for that infection. And we spoke a little bit about how the medicines they interfere, but the medicines also are affected by the bacteria, like we spoke with the lactobacillus, but they also can affect the bacteria themselves. So being on medicine changes your gut bacteria. Being on levodopa, being on entacapone, being on pramipexole, they can change the gut bacteria because the effect of dopamine is not limited to the brain. It can affect multiple parts of your body, including how your bacteria interact with your intestines and effectively which bacteria can stay alive and which bacteria cannot. So as we understand more, it will be interesting. But at this point, our understanding is limited, that there is a change, but we don't know more than that. But it will be interesting to see how the medications we use for Parkinson's disease interact with the gut. So there is many more things to discuss here, but I would just want to give you the chance to ask me questions so we can speak more about constipation, swallowing problems, drooling. There's so many other things in the GI tract and nutrition, but I thought that will be enough information for today from my part. But if you have any questions, I'd be happy to answer it. And as I said, I would recommend that you consider getting the book. It has a lot of great information that are practical information. It's not simply a list of facts that you can use on a day-to-day basis. And thank you for your time. Susan, you are muted. Susan, I think you are muted.
I'm unmuting myself. I'm sorry.
That's okay.
I keep talking all the time, and then I realize that. I apologize. Does anybody have any questions? You can unmute yourself and.
Are you unmuted?
Doctor.
Doctor.
Yeah.
Is fish in your diet? Is that you didn't seem to talk to fish.
Yeah, so the Mediterranean diet has a high component, like a percentage of fish and then seafood in terms of the meat percentage. So at least like once a week fish. That's like the part of the Mediterranean diet. Now, the only thing to watch for fish is that make sure that it's not because there's a lot of heavy metals, especially with the higher in the food chain fish, like swordfish and shark and stuff like that. But in general, it is part of the Mediterranean diet. So it will be something I would recommend to increase if you're not eating once a week in your diet.
We lived in the Caribbean for 20 years after we retired.
Yeah.
And we ate fish probably 3 times a week, 4 times a week.
Yeah.
And in their traditional diet, they ate a lot of fish.
Yeah.
To the point of almost no red meats because they couldn't get them. You know, you can't grow that type of animals down there easily. But the good part of it was that people had fish, and people would contribute fish to the diets of people who didn't even fish. You know, they'd go out and fish. The fishermen were the lead citizens in the societies. And what they would do is they'd bring back their extra fish, leave them on the beach, take home what they could use, and leave the rest there. And the people in the villages would pick up the fish from the beach and include them in their diet because they were looking for protein all the time.
Yeah. And then unfortunately, like I don't know exactly like if the fish has a direct effect for Parkinson or not. It's simply the reason I speak about it is because it's part of the Mediterranean diet. And we know that people who are eating more Mediterranean-like diets tend to have a lower risk of Parkinson's disease in these small studies that I mentioned. But hopefully we would know more in the future. I have a question here in the group chat from Kelsey about any effects with simple carbs versus complex carbs. We don't know that yet. We don't know anything much about carbs. It's really interesting to see what simple carbs like sugars and stuff have any effect or not, because they change your gut bacteria. So it will be interesting to see if they have any relationship, but hasn't been studied.
Doctor?
Yep.
I have not been diagnosed with Parkinson's disease. I'm diagnosed with Parkinsonism, MSA, multiple systems atrophy.
Yeah.
How much of what you report today and what you have in your book applies to me with multiple systems atrophy?
Yeah, we don't know exactly how they interact. The amount of studies on these Parkinsonian disorder is much, 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 much lower than the amount of studies for Parkinson's disease. So in many cases, we assume that they're the same, but we know they're very different disorders. And so I wouldn't feel comfortable to simply say, okay, this is what we see in Parkinson, this is what we see in MSA.
Yeah.
So it's at best, it might be tangential, it might apply, but I cannot tell for sure. So the book itself is more to the people with Parkinson's disease rather than the Parkinsonism, but there could be certain overlaps in terms of certain things, but I cannot tell that for sure.
Thank you so much. Very good.
Doctor, what about children of parents that have a parent that has Parkinson's? Should they establish early on a certain diet, or you recommend a regimen that they should follow?
So that's something similar to this has been done for a study. It's not done yet. It's a continuous study. So people who have a genetic mutation that they know is going to put them at a high risk of Parkinson's disease. So some of those less than 10% of people who have a mutation, these people, even before they have symptoms, they're being evaluated to see like what type of diet they want to try over time to see if that will change the risk of Parkinson's. So at this point, we don't have that information. Usually I recommend that for anybody is to try to have a healthy diet. And then at this point, Mediterranean diet seems to be a healthy diet, but there are other similar diets. Like if you don't like Mediterranean food, there's like Japanese diet is quite similar. So there are other diets that are very similar that I would recommend. But yeah, at this point is simply like how I would recommend for anybody else is to try to have a healthy diet. And hopefully once we know more from those studies, we have more direct information.
Thank you.
So I have a question, Doctor. Hi, I'm Alex Redmond. I serve our amazing members of Parkinson Place.
Yeah.
I'd like to know if you could give some simple tips that people can leave this webinar today with, saying, okay, I'm going to go and get my groceries or have my groceries curbside. And for the next week, I should be eating these things to help my gut bacteria.
Yeah.
What are like 5 things that they can pick up that's going to help promote healthy gut bacteria to help prevent constipation?
Yeah. So it's good that you mentioned constipation, because that's something we know about what can work for constipation. Whereas if you had told me what will help for motor symptoms, for stiffness and slowness, I wouldn't know the answer. But for constipation, let's take some examples. So legumes are good. So any legumes in the supermarket, whichever you like, that could be good.
Can you give people some examples of
Yeah,
those?
yeah. So let's say if you want to get like zucchini and stuff like that, that could be good. Another thing that could be good are any bean, whichever that finishes with bean, like chickpea, red beans, fava beans, any type of beans. These will be good. They will help your gut bacteria anyways, because your gut bacteria love to eat those. The other thing is you would have a large fiber food. So that will be like cabbage, lettuce, spinach. So anything that has a large leaf that you're eating, that usually is a good thing to add to the diet. And also you want to have some consistency in the stools. So having a starchy food would be good. So a tuber. So that could be a potato, but maybe better a turnip. Or something like that. That could be something you can consider. And then other than that, then you can, if you're not plant-based only diet, because this could be enough for a plant-based diet, then you can, if you want to add some animal protein, then I would recommend a fish. If you do that, that would be better than other meats as far as we know right now. But so that's usually something. So a combination of large fiber with something that gives consistency, like a tuber with complex starches. These usually would be a good combination to help constipation.
And would you recommend eating raw foods, a combination of raw foods mixed with, say, steamed and cooked foods that are either lightly sauteed in like an olive oil and then steamed as well? Because that's pretty easy to cook. They could throw the vegetables into a steamer and then just sprinkle something natural on top.
Yeah, it's important. Like if you always ate like a meat and potato diet, you cannot switch immediately to this diet. You're going to feel horrible. You're going to have bloating. You're going to curse me forever. So it's important to eat in and slowly introduce it and be very consistent. If you're very consistent in eating these types of food in your diet, you will be less likely to have bloating, and then all the other complications of eating legumes and beans and fiber. And then if to ease yourself in, starting with cooked vegetables will be easier for digestion. So fully cooked, not just sauteed, but fully cooked, and then slowly incorporate them. Now the advantage of uncooked you'll get more of these phytochemicals, these antioxidants inside the vegetables that you might lose with cooking. So as your intestines get more used to eating these raw things, which are harder to digest, then it might be better over the long term, but you have to ease yourself in. You cannot simply start eating like tons of vegetables. You're not going to be happy.
And if people change their diet and they've slowly weaned themselves into eating healthier, say by a month, they've started slowly, every third day, then every second day, every other day, and then every day it becomes a habit. After that month, how long would it take for them to actually start to feel a result after that? And particularly with constipation, does seem to be a topic that many of our members are experiencing. So
constipation, if you're eating a steady diet, like if you reach that steady state and you're already on a stable diet with, so effectively, when we're thinking about a Mediterranean diet, a very important thing to consider is that a Mediterranean diet is a very varied diet. You don't eat one thing when you're eating. So you're eating more than one thing. It's like almost when you go to a tapas restaurant, and then you have a small thing of multiple things. So you have leftovers from yesterday with something from today, and a little bit of a fermented food on the side, or something like that. So So effectively, you're getting more than one thing. And then once you reach that steady state, usually within 48 hours, you should notice that whatever you're eating should reflect within 48 hours in your stool passage. So it shouldn't take a long time. The first few weeks are going to be a little bit tough. You might have diarrhea, you might have bloating, you might have extra gas, you might have indigestion, especially and if that happens, that means you're moving too fast. And then you have to do it slower to get your bacteria time to change and adapt to what you're eating.
Okay, thank you.
There is another question from Kelsey about consistent exercise. So this is like one of the most important things you can do in general for Parkinson's disease for multiple reasons. We know that exercise can slow down the risk of falls. So it's very important to maintain independence. And then in addition to this, it can help your bowel movements, which means that it can help your nutrition over the long run. So if you exercise regularly, your bowel movements are more regular. So that is very important. So usually the recommendation is that you exercise at least 4 times a week. But that doesn't mean you exercise for half an hour or an hour and then you spend the whole day watching TV. Staying active through the day is important. It doesn't need to be exercise, but moving, staying active, not sitting in one place, and not relying only, okay, I'm going to the gym. I'm going to do that half an hour and then that's it. That's not as good as trying to be active as much as possible.
Anybody have any other questions?
You know, unmute. Alan, you have a question, don't you? About nutrition? You're muted. We have Alan.
No,
Alan Shedd.
Don't
There
you
you
have a
go.
question about the food and nutrition and gut bacteria? You always have good questions.
I
You have
didn't
a perfect diet, Alan?
yeah, I eat pretty healthy.
Okay.
How about
I have a
steel cut
question.
oatmeal to kind of set the tone in your gut?
Yeah, so it gives you fiber, so that can help. And then also the bacteria love to munch on that thing. Now, is that going to be the good bacteria that we want that for that bacteria to munch on? Is it the oats, or that we need to give it more broad beans? We don't know for sure. And at this point, because we don't know, and it can help your constipation, I think it would be a good thing for you to consider. Now I have a question here from Pam about Miralax. Miralax is a good medicine that you would add if, for example, whatever you tried with food changes is not helping, and that's quite common in Parkinson's patients. So don't feel bad if you try to change your diet and you're still having constipation that's not controlled, because there is a change in motility of your gut. It's not simply what you're eating. So in many people, you need to take Miralax every day or every other day. Miralax works by bulking your stools, making it larger, so make it easier for it to move in. So that's similar to what I said with these tubers would be doing. So like turnips and stuff, they will be doing a similar job, but Miralax will be much more concentrated, and then it works for some. It is needed for some people.
Is there a downside to using Miralax daily?
If you that diarrhea, that's the major downside, and bloating. Yeah.
36 people on this.
Thank you.
A lot of the members of the men's peer group drink prune juice.
Yep.
What is your feeling about the prune juice?
That is one of the ingredients in that in the book's constipation formula. It is a third prune juice, third oats, and third apple juice. Not oats, bran. So bran, apple juice, and prune juice together to give you like that. You take a spoon every morning to help your intestines move along.
Oh,
What time of the day do you recommend that?
Usually I recommend that in the morning, unlike Miralax, which I would recommend at night. This one I would recommend in the morning. And if you do it every morning, then you would notice within a few days that your bowels will become more regular. It doesn't work for everyone, but it's a simple thing that you can prepare.
Thank you.
I have a question from Roger. Is it okay to take calcium, magnesium, and supplements and vitamin D3? It is okay. It doesn't interfere as far as we know with Parkinson. So if you need it for other reasons, it is okay. People with Parkinson tend to have thinner bones, but not significantly, which means that they're not significant, statistically significantly, but because they might be eating less, they might have less calcium and less vitamin D. And a similar question about essential oils. There are some studies about omega-3 and omega-6 fatty acids. So these are the ones that you get like krill oil. The omega-3 ones seem to be a little bit better than the omega-6. But again, these are very small studies, so I wouldn't want you, that's not like, I don't know the dose, I don't know how much you need to take, but they might interfere with the inflammation markers, and then but these are small studies, which means once we do big studies, we might not see that same signal, but possibly there might be a relationship. Now, the other essential oils that we could be speaking about could be like distilled oils, like that be lavender oil. I'm not sure if that's the question or not. So if that's the question, if you can text that back, because that's a different question than the other oils. Because for me, essential oils are oils that our body doesn't produce, like those oils, like omega oils.
Milk. Could you talk about milk a little bit?
Yeah, so it is interesting that multiple studies in different places, like there was a Finnish study from Finland and one in the United States that looked at a large group of people and saw people who, depending on how much milk they consume, and people who consume more milk tended to have more chance of having Parkinson's disease. And we don't understand that very well. It could be related to how much pesticides are, because cows eat the hay and grass, and that might be sprayed with pesticide, and that pesticides accumulate in the milk, and then you drink the milk, and then the pesticide accumulate in you, and we know that pesticides are linked with Parkinson's, so that could be the reason. So we don't understand it very well, but it is interesting to see that relationship.
How about talking a little bit, if you will, say milk, fat-free versus 2% versus whole milk?
That I would assume shouldn't affect Parkinson too much, but with the information we have, because we don't know exactly how fat interacts yet with Parkinson's disease.
Thank you.
There was one study though with in rats, and they fed them low-fat milk, and then they didn't do as well as full-fat milk. But I'm not sure if that means anything. It's just it's very minimal, so I wouldn't go that. But it's just interesting to see. Roger asked a question about the amount of protein. 60-year-olds, you just might need a tiny bit more than a 70-year-old, but not that much. So it will be very similar, around 4 servings of chicken breast or the equivalent. So that will be around 80 grams of protein a day.